Hey, this is Sportsslaw with Lomas Brown, the pro.
And Deb Schneider, I'm the prof. And together, we're the pro and the prof.
Oh boy, it's a good day to podcast.
He really doesn't have to have that laughter in there, because every time I hear our introduction, I laugh. So I do the same laughter that we recorded in there. I know.
I
know. How are you, Deb? How are you? How are the family? How's everybody doing?
Everybody's doing good. We've been staying in, wearing masks, social distancing, trying to keep everybody safe. We've got a wedding coming up in a month from today. So, and
everything's still a go, huh, for it?
Everything's still a go. It's gone from 240 to 12, but
I've had a friend that he was supposed to get married in October. Now this way back to April, and they're still having their fingers crossed that they'll be able to do it in April. So, they're just riding with the wave there. Wherever the wave take them, that's where they're going.
That's what you got to do.
Yeah,
the kids are getting married, and then in a year we'll have the big party.
Yeah.
Hopefully.
Well, that's the safe thing to do, and I'm hoping that everybody just real fast. The holidays are up, and I hope everybody's social distance, because they were just talking about how the Thanksgiving. I don't even know if we've been through that surge yet. They were saying a surge on top of a surge. So I just don't know if we can handle another surge around Christmas, just dealing with the Thanksgiving Day thing. So I hope everyone takes it serious and really try to, put off this holiday and maybe next year, so everybody could be there next year.
Right. Or celebrate the holiday after you have your vaccine. Celebrate the holiday later.
Yeah. That could be a nice little celebration.
Christmas in February, Christmas in March, something like that.
One of my gifts might be a syringe for somebody. That might be, no, I'm just kidding, Dad. Go ahead.
That could be taken so many ways.
I know, you're right. Go ahead, stop me before I say something I'm not supposed to say.
So there's so much that's happened today. Today is a huge day in sports, a huge day in medical. I mean, we're going to be talking to Dr. Rodney Rhode and Dr. Anna Durbin, epidemiologist, working on vaccines from Johns Hopkins, from Texas State. I mean, this is fabulous. I love our guests. We also have some things that really happened in sports today that are huge. Number one, the Negro Leagues have been recognized as Major League Baseball.
Finally. Yeah. It just really didn't make any sense to me why it was separated at all. So I'm glad they've done the right thing. And they said some of the records of some of the great players are going to even go up, like Willie Mays and some of those guys. So it's going to be unbelievable once they do
Love to see what Jackie Robinson looks like, Willie Mays, Satchel Paige. That's huge.
Yes.
The other thing that's going to change, I mean, that's kind of a past. Now looking future, the Supreme Court agreed to hear the Alston case. That is that pay for play, basically, for college athletes.
Yes.
This could change everything.
Yes, it's been a big thing. Actually, probably about a couple of months ago, I talked to the University of Florida's assistant AD, who we need to get on this show. But back then, it was a big concern of hers, where how they were going to deal with this name, likeness, and image thing. And they were taking steps then towards how it's going to look in the future. So this is a huge decision that has to be made by these universities on how they're going to handle this.
Well, one of the big things on that, and we need to do an entire podcast on this, but we have the NCAA who has who's trying to get something passed in Congress, and who's telling Congress we have 3 or 4 different bills that are pending. We also have a number of states that have passed bills, Florida being the first one that's coming into effect. Florida, California, we have one in Michigan that's looking. So if the states are all different, where does the athlete go?
Yeah,
but
true.
So that we'll save that for another podcast.
Yes,
this time we have got our doctors are back.
Yes,
so
our doctors.
We've got Dr. Rodney Rhode from Texas State. We have Dr. Anna Durbin from Johns Hopkins.
Dr. R and Dr. A. Hey.
That's right. There you go.
in the house.
And vaccines. I mean, I think that's the big thing. Vaccines, and how do we deal? Are they ready? We're starting now. I think this week, 2 days ago, was our very first vaccination.
Yep, and there'll be more next week. We'll have another vaccine the end of this week, likely to be authorized by the FDA. And this one, the one that's going before FDA tomorrow, has much easier storage conditions, so it can be distributed a lot more widely probably than the Pfizer vaccine can. But it should at least double our supply, which will allow more people to get vaccinated quicker. Still not enough.
To back up, Pfizer has difficult storage because it has to be kept so cold.
Correct.
Moderna is the one that we're expecting. And then AstraZeneca is the one that you're currently working on.
And I'm working on, and just because of the sad state of COVID in the United States, I think that we'll probably have efficacy results for AstraZeneca in January. It would not surprise me if it goes before the FDA in January, just given how many cases a day we're seeing of COVID here in the U.S.
A quick question for me. I know one of them, the first one, right? In that you have to take 2 of those. Am I correct?
You
what about
are.
the other ones? What about the other ones coming out? Will you have to take 2 doses of that?
Yeah, that's a great point. So the first one, the Pfizer, is 2 doses, 21 days apart.
Mm-hmm.
The second one, Moderna, is going to be 2 doses, 28 days apart. AstraZeneca is 2 doses, 28 days apart. Johnson & Johnson has a vaccine that's currently in clinical trial. Hopefully we'll get efficacy results in January, early February. That's a single dose. So that will be a game changer as well if it's a single dose. It allows, the doses to go much further. And also, although I will say what's been very, very interesting with both the Moderna and the Pfizer vaccine is it looks as though, even though it requires 2 doses, in their efficacy results, it looks like it started to protect people as soon as 7 to 10 days after the first dose. So you do get some protection before even you get the second dose, which is great.
So for those of us who are scared of needles, we wait.
But still, you need to get the second dose, but you'll get your protection. It looks like you'll get your protection earlier, which is nice. I mean, that really can be a huge public health benefit.
Wow. And Doc R., how's Texas?
Texas is cooking just like California. I mean, we're unfortunately, and I'll cut it, kidding aside, it is really sad. Lomas was talking before we started about, the Thanksgiving time frame, and now we're moving into the holidays of Christmas and New Year's. So, I think most people that are involved with healthcare, like myself and my colleagues and Dr. Durbin, we're basically pleading with people at this point to try to follow all the precautions and, really try to limit those Christmas interactions. Immediate family, if you've been living together, it's probably not a problem. But, as you saw last week, the CDC even has now started recommending masks indoors if you are a mixed population. So just a lot of troubling stats. My wife, we were sitting here at the dinner table before we started, and I looked at her and, another news flash of over 3,000 dead today. And
yes,
I just have moments, where I stop and think about 3,000 people died today. I mean, and several times, and it's been day after day. And so I didn't grow up in the time of Vietnam. I was young, but I mean, this must be what it's like to watch the nightly news and see a 9/11 every day. In a different way. It's really sad.
That's what I've been thinking about, Doc R, too, is just, I think if this had been an armed conflict where we had 3,000 soldiers dying a day, I think the leadership, the President of the United States and the Congress would be doing something.
You would hope.
And, it's really sad. You're right. It's 9/11 every day.
Yeah, I think I saw the other day that the top 10 worst days and deaths in U.S. history. There was one, that was like Civil War era that was about 8,000, but that was about a week ago, and Pearl Harbor was still in there, and 9/11. Those have fallen off. I mean, there's 7 or 8 days now that are COVID based, and it's just crazy. It's just almost surreal and unbelievable to see that.
One of the things that I think that we can talk about here is the fact that a lot of people are saying these deaths and these stats are inflated. When we're talking about 3,000 deaths, and I just want to check with both the doctors, we're talking about 3,000 COVID deaths. That's not counting car accidents. That's not counting drug overdoses. That's not counting anything else. We're talking COVID deaths. Am I correct on that?
That's right.
Yes, absolutely.
Now, I think I might have heard something disturbing that I hope you doctors can correct me if I'm wrong. I'm hearing that a lot of, even when people come in, if they don't have COVID or anything like that, I heard a lot of deaths are being put under COVID. Is that true? Is that not true? I heard it was more for COVID deaths than, am I completely off base with that? I mean, it was something that I thought I heard that, a lot of that you get, that it's more for a COVID death, or I'm not really sure, but is that something that I'm really off base with?
So I think it's all in sort of the recording. So people come in with COVID, they can experience a lot of complications from COVID. So they can experience, of course, pneumonia, they can experience kidney failure, they can experience stroke, but that stroke is directly due to COVID. So these are COVID associated deaths. Yeah.
Okay.
Yeah, I think you probably touched a chord of frustration for many of us in healthcare and public health that hear those types of statements and see them in comments on social media and things like that. It's frustrating. In any event, I'm a big antibiotic resistance healthcare associated infection researcher, and certainly there's going to be some data that occasionally has maybe the wrong case ascribed to it, but not thousands and thousands and thousands. I mean, the primary cause of death is COVID, and as Dr. Durbin said, you can come in with it, and even if you die of a heart attack or some coagulation issue, it's COVID induced. So it is a COVID death. And again, that's an interesting comment, Lomas, because I have those conversations with family and friends all the time that say things like that. And it's just, again, it's a frustrating issue sometimes in public health and healthcare right now.
That's why I wanted to point it out, because I want to clarify it, because we're hearing it, we're seeing it on social media, and that does not include the suicides and mental health issues and the other deaths that are indirectly attributable to COVID or the pandemic, or So let's turn to something a little different. Vaccinations. Athletes getting vaccinations. Right now, athletes are getting more tests than any of us.
Yeah.
Lomas, I'm sure you're well aware of this. How many times do the Lions get tested?
Oh, it's every day. It's every day. And actually they brought in other tests now. And both docs know where now they take a test right before or right when they enter the stadium or before they leave the hotel to head to the stadium, and they'll know before those guys get to the stadium, so they can alert them. It happened, Doc, that's what happened to Dez Bryant.
Yeah.
That's right. Dez Bryant. That's right.
Yep.
Exactly right. They pulled him off the field because he had just took a test not too long ago, and it came back positive. So they pulled him off the field. He was warming up and they pulled him off the field. But that was, doctors, that became a sense of concern for the NFL, because they said, well, if he got to the field, which, it was other players there. So, again, they're trying to get these tests as accurate and as fast of results from these tests as possible, so they can, I guess, try to head off situations like what happened to Dez Bryant with Baltimore.
Yeah.
So can you tell us about the test? Like there are 3 tests that I'm aware of. Am I right? Am I wrong?
Well, so there's tests for the virus.
Tests for the virus. Okay.
And then tests for antibodies, which they're not doing. So they're doing different virus tests, and some are what they call an antigen test. So what they'll do is they'll essentially have a kit that has materials that can bind to parts of the virus if it's there, and then they'll light up or they'll show a line on a strip, and that'll say, yes, it's positive. And then they have the PCR tests, which actually amplify or essentially using reagents make the virus multiply itself, so that if there's a little bit of virus there, you may not be able to detect it, but as it multiplies, then you can detect the virus. And the antigen tests or the quick tests have more false positive tests than PCR. PCR is generally quite sensitive and specific, but it takes longer. The rapid tests, just by their name, rapid, is why they're given like as they're going to the stadium, because they can have that result back in just several minutes, but it does have a higher false positivity rate. And so most of those then, if you get a positive antigen test, then they'll go back and do a specimen and see if the PCR is positive.
Do they have false negatives too?
Oh, yeah.
On those?
Yeah.
On the rapid test?
You can look at these. I mean, the way a lot of healthcare uses it, I'm sure sports does too, is the antigen test is rapid, as Dr. Durbin said, and sometimes it's used as a screening test. So you can do lots of people. And think of it as like using a large net, and you're trying to catch as many fish as you can. But that RT-PCR test is more like like you're spearfishing. I mean, you're going to get that one positive, and usually it's more right and more correct. So, and I'll throw in again, because, as a medical laboratorian, one of the issues that we see, and we don't need to go down the rabbit hole of test accuracy, because there's so much to talk about, but one of the problems is specimen integrity. So it's critical. And so I think I've mentioned on this show before, you can have the gold standard test, but if you get the wrong specimen or a poorly collected specimen, you can't resurrect a dead organism or something with respect to the nucleic acid not being there or degraded. It didn't get stored properly. It didn't get collected properly. So there are issues. And I just mentioned that because of what Lomas said. So it's really nobody's fault, probably. It's just that there is no perfect way to know, unless you're going to test every 5 minutes and make sure all the parameters are correct on every player. It's difficult. So, I mean, if you can get 90%, you are doing probably outstanding, in my professional opinion. And probably 80% is probably more likely. Yeah, but it's problematic, when you have to yank people off the field or.
Oh my gosh, you're right. It not only affects that player, but the rest of your teammates. Could you imagine that your star getting yanked out 20 minutes before you're getting ready to go on the field? I mean, you're right about that. Yeah, but the other thing I wanted to comment about was, we talked about the NFL, you talked about professional athletes, and Deb, you seen where the NFL came out and said that they wouldn't jump ahead and try to get their players vaccinated. They already said they weren't, because they know the public would have ate them. That would have been a public disaster. If you're talking about 20, 21, 20, 25-year-old healthy professional athletes getting vaccines when you got 3,000 Americans dying every day, that just would have been ugly for the NFL. So they did that. But listen to this. So what they did was they reached out to the NFLPA, us retired guys. And what they're trying to do now, they're trying to encourage us guys to go get the test, but they want to use us as public service announcers for the public. Meaning they want us to assure the public that these, about us getting the vaccination. They want us to kind of be like like a public spokesman, for lack of a better word for that. And, you got some guys, and of course, a lot of us are in that area, 57, 60s, 70s, a lot of us ex-players are. So that was the other thing that is permeating throughout the NFLPA, and I think that might have came down from the NFL. I wouldn't be shocked if some of that came down from the NFL, for us to kind of become the spokesman and for guys to get vaccines. So you got guys kind of on the fence. I talked to a few of them. They're on the fence about taking it.
It's interesting you say that, Lomas, because I do know that the head of Operation Warp Speed and part of their public outreach and community outreach did want to get professional athletes involved in that, because it is, we as scientists, and Dakar, you probably know this, we can talk and say, oh, you need to get vaccinated, get your do, but if you have a celebrity or a professional athlete say it, people are like, oh wow, I should really do that.
Yeah.
It's really interesting. I mean, it goes sometimes a lot farther because people are, you're looked up to, and you're looked up to, but you're also considered real people. You're not just some talking doctor who who's just saying that because that's their job. No, and so I think it would go a very long way to creating public trust in vaccination. But I think also, you want the athlete to be comfortable doing that. You don't want to feel that you're being pushed into that situation.
Exactly right.
Yeah, and as you know, and Dr. Durbin knows as well. I mean, people of color is especially important that you're out because of the history of that. So yeah, I mean, I think it's critical that not only you guys do it, but other leaders. You've seen all the former presidents are planning on doing it publicly, and I heard today just before the show that Major League Baseball is looking at pushing their season. This is just a proposal, pushing their season maybe back a month or two, trying to get everybody vaccinated, and then start the season a little later. Kind of what you were talking about with the NFL, but shorten the season to like 140, 130 games. But it'll be interesting. The public perception of athletes, as you know, is a little dicey around.
You're right. You're right.
I mean, I have no issues with it. I mean, we all need to be vaccinated, and if you can keep community transmission out of a sports event, it makes sense to me. But people will look at that differently for sure.
Yeah. And whether you certainly in the tiers that they're doing, tier 1A and tier 1B, where you're looking at healthcare professionals and first responders and then workers in nursing homes, certainly, those need to proceed. And then you get in, it's really interesting trying to figure out, okay, tier 2, how do we decide, quote, who qualifies for these different tiers? And then, the problem is we're not going to have enough vaccine. Probably like tier 1 probably won't get vaccinated until January into February, I would think, even just given the numbers of doses. Pfizer, unfortunately, said they can only produce half the amount of vaccine that they at first thought that they could produce. But as these vaccines come online, that will certainly help immensely.
Yeah. It's a really interesting point because you can't, you do want to get the celebrities, you do want to get everybody vaccinated, and the celebrities, for better or worse, we follow them. Yeah. We follow. So I think the NFL is really kind of onto something there.
Yeah.
By, getting the retired athletes.
Yeah.
Because everybody knows the name. Everybody knows your name.
Yeah, you're right. And
I have walked down the street with you, Lomas. Everybody knows your name.
It's crazy. Like a Boston theme song.
I know. You're right, Doc. You are so right. But you're right. It is going to be interesting to see what happens with this. And of course, you can see who has the money. If you look at the college game compared to the pro game, and you see all the cancellations in college and the postponed, the NFL hadn't canceled the game. If you notice, not one NFL game has been canceled. It's been moved, it's been delayed, but it hasn't been canceled. And, it's a big difference between college and the pros. And I think it's just a money issue with them. That's why, the pros are able to do some of the things that they were able to do. And of course, you can control them a little bit more than you can control 19, 20-year-old kids on a college campus.
I did wonder, though, Lomas, I'm thinking of the Ravens game. So the Ravens were supposed to play on Thanksgiving, and then it was moved to Sunday, and then it was moved, I think, to Tuesday. And my question was it really safe? That was a short time. And, and not knowing, you don't know how many players tested positive. You don't know who the players were. You don't know how many, was it that you had 1 or 2 players that tested positive, and then you had 30 that were in quarantine waiting to see. And once they came out of that and tested negative several times, they were good to go, which I'm hoping that was the case, because I was doing the math thinking, how can, Michigan's not played 3 straight games, and the Ravens are, played within a week of when they were supposed to. So I thought that was interesting.
Doc A, that's a great point, because now think about it. You asked him, was it safe from the standpoint of COVID? But then the NFL has to look at it from there you go, Deb. Exactly right.
Yeah.
Like Pittsburgh, for example, they were supposed to play, and Doc, you know this, Doc R, I think they were supposed to play 3 games in 28 days. That's how it was calculated at first. But when they had all these things that came up, they played 3 games in a span of, I think it was under 20 days.
Yeah.
Ooh,
And that will kill your body, man. I mean, it's hard to recover. So what happens is you have guys put in a position where, they could get hurt again. They're fatigued, they're tired. And anytime you get fatigued and tired in a game, that's when the injury bug gets you. So, the NFL is not only dealing with the COVID from health perspective, but also the players. How are you going to keep these players healthy in this physical game that you're trying to condense this season down into?
Yeah.
And we've seen, we had a basketball player, Conte Johnson, collapsed on the field.
Yeah.
University
of Florida.
Yeah.
They're saying that he had COVID, and this might have been an after effect. Doc R?
Yeah, I mean,
Doc A, can you speak to
myocarditis?
Right?
Yeah.
I mean, that's a pretty scary effect from a college athlete standpoint.
Yeah.
Yeah, especially when it happens in, public viewing point like that. It's horrifying. It takes me back to Hank Gathers. And
that's right.
And all these other guys that I grew up with. I mean, it's just terrifying. Speaking of, they're in the public's eyes. So, I mean, it really brings it home that, again, whether it's a direct effect or an indirect effect, we still don't know. As we move forward, there's still going to be some issues, I think, with this group of individuals called long haulers and others that, we're dealing with and we're just now learning about. I mean, people having massive problems. And I've read some literature recently that some of these long haulers are starting to show kind of autoimmune issues that, you see with, it's just, we just don't know. And when people tell
I'm
me
watching that B-roll, I mean, it's horrifying.
That's hard. It's hard to watch.
Yeah. But when people, don't know the effects and they talk about, well, I just hope I get it and get over it. No.
No. Right.
I mean, get the vaccine and don't get it. I mean, that's the better route.
Yeah.
Yeah. And I think.
Go ahead, Doc.
I was just going to say, I think too, the fatigue, the long-term fatigue that people have. And then as an athlete, if they're supposed to play through that long-term fatigue, I mean, just watching that, you look at that and he clearly passed out, and whether it's because he, couldn't support his blood pressure, he was just fatigued, I think, I hope they take good care of him, because that is very, very scary.
Yeah. They talked about I don't know if you remember when Cam Newton had it, and he came back off of it, and he said for 2 games afterwards, he said he wasn't himself. He said it was like he was in a fog. His respiratory, it was affecting him. And, again, like you guys are saying, they don't know. I don't think the team doctors, I just think nobody knows the effects, or I guess how it's going to affect each individual. But I know Cam Newton said he had problems for a couple of weeks after contracting the COVID.
And that's another point. Athletes tend to play through injuries and play through sickness. And Lomas, you have some great stories about that. But we've heard a few. But they do tend to play. So that also brings up the fact that they're not going to stop. We're not going to stop. And we're probably going to see, I hate to say it, but we're probably going to see more of this.
Well, Deb, that's why the trainers, they got to protect us from us. That's what you have to do with an athlete, because you're right. We're going to go out there. We're going to push through it. We're trained to do that. So they have to protect us from ourselves, because you're right. It could be catastrophe.
Yep.
And follow the athletes, follow the people for long term. So they may look fine a month later, but what happens 6 months from now, 12 months from now? Are they predisposed to long term complications that we might not even know about yet?
Right.
Yeah.
This disease is not even a year old.
Right.
No.
Right.
Now,
Right.
Doc R., you wrote an article. I want to flip a little bit. You wrote a great article about the lab workers and the fact that we have so many people who are dependent on what the lab workers are doing.
Yeah, thank you. Thank you for pointing that out. It's obviously one of my passions is to talk about my students and alumni that work in the medical laboratory area. But it's really, it's really a family healthcare thing. I mean, we're all tied in together.
Right.
Dr. Durbin knows as a physician, she's kind of handcuffed without laboratory results. And so, and we need respiratory therapists to help people and nurses. So, it's all a big group thing, but we're behind those laboratory doors. So sometimes people don't realize what we're doing and how critical we are. Some of my alumni and some of my colleagues, the article is virtually about, we're just exhausted like everybody else.
Yeah.
We're mentally, physically, emotionally exhausted and work, just nonstop work. And as we've talked about, heart attacks don't stop, cancer doesn't stop, sickle cell disease doesn't stop. Infections of other types don't stop. So it's just gotten to be overwhelming. And my biggest concern, and a lot of concern for all healthcare, is that some of the younger professionals are talking about walking away from it.
Yeah.
When this is over, they're just so burnt out and tired that, and we were already at shortages going into this pandemic. So, and physicians and nursing and everything else is too. So it's just, as we've talked about before, we've got to get these people, one, protected by that vaccine, because when you lose someone, if you lost a Dr. Durbin, you're talking about, you can't replace a physician. You can't do that, in a short amount of time. So if you start losing a generation of people that have that expertise, whether it's an epidemiologist, a physician, or whatever, it's devastating. And we're fortunate in our country because we have lots of them versus countries that lose the one doctor, right? And
Right.
So
And don't you think too, I was going to say what's really contributing to that is that masks and, COVID has become so politicized that I think for healthcare workers, it's so frustrating because you have people who are like, I don't care. I'm not going to wear a mask. It's no big deal. And then you have people on the front lines who are literally risking their lives taking care of people.
Yeah.
And half the country just doesn't care. Half the country just says, let it rip. And I think that's what's really frustrating.
I have those conversations daily. It's just, again, it's unbelievable. But not to take the story away from the lab, but you can look at any healthcare professional, and I think we all are. Everybody's tired and everybody's fatigued by it, but seeing that kind of that adds to the stress when you see that kind of behavior, and it's just. It's just almost unbelievable to hear that kind of chatter and see people just kind of blowing it off when it's just right in front of us every day. So,
are there any other type of long-term effects that will affect the hospitals? I know you guys are talking about the doctors, the individuals. Are there any other type of long-term effects that will affect hospitals because of the COVID, because of what we're going through, the strain that's being put on these hospitals? Will there be anything long-term, any long-term effects?
That's a great question. What I don't know, financially, I think, at least at the beginning, it was a huge financial crunch on the Hopkins medical system.
Yeah.
And they made cuts in salaries and benefits to offset that. And so far they're saying that, they're okay. But what you'll see, I think, long-term, and Doc R brought this up. So now your hospital is full, your intensive unit is full, and you've had a massive heart attack and we have no place to put you. It affects other diseases. and people don't want to go to the hospital when perhaps they should because they're afraid of getting COVID and they're afraid they won't be able to see their families in the hospital. So diabetes goes untreated, kidney disease goes untreated, high blood pressure. So I think in terms of the health effects of the country, I think you may see lasting effects that we haven't even recognized yet.
Yeah, I can speak to that. It's something that people don't see. This is kind of behind the scenes, and it's not just for laboratory, it's for nursing and I'm sure physicians and everything else. It's the training, the clinical training. So as a chair and a program director of medical laboratory scientists coming this spring and summer, we typically do 5 different 3-week block rotations in different parts of hospitals, different laboratories. We've been able to line up one of those.
Wow.
So I'm frustrated, and I'm actually almost in a panic because this is kind of what we did last year at the end of the spring is we were able to get 3 out of 5 rotations last year. The rest we had to do the best we could in-house and virtually. And literally, and this is everybody. This isn't just me. This is meaning people will graduate and they're basically going to have to onboard with more oversight and more help to support those new professionals because they won't have the experience of all situations. Right. This is a bit of a scary thing that people don't know that's kind of behind the scenes. So if this continues, you could have 2-3 graduating classes of people that, and again, we talk with our affiliates and say, these guys are great students, they're great graduates, but they haven't had the number of hours that they typically would have. And we need you to basically orient them and bring them on board with a little more training time in-house as an employee because we couldn't get it done. And it's nobody's fault. They're not allowing students in right now in these massively, traumatized hospitals. So that's something to keep your eye on. It could have an effect downstream of quality.
Medical students too. You're right. Our medical students weren't allowed in the hospital the first and second years, and then they wanted those. Then they wanted the 4th-year medical students to actually be acting as physicians in the hospital to take some of the load off, which, again, not necessarily having all the training they would need.
Well, I think you've pointed out something really big. Okay, the dog needs to go out. We started this before we even went on air talking about training and teaching virtually.
Right.
And that's really, there's something lost, especially in any kind of clinical program. And, I come at it from law. If you're not there, not in front of the court, if you're not seeing how the courtroom actually works and you're just on a Zoom meeting, or if you're trying to learn how to give somebody a shot, or if you're trying to do this training, if you haven't done it, if you haven't actually done it, that's hard.
Right. There's just no way you can simulate a frenzied emergency room or a full, a massive blood transfusion protocol. You cannot simulate that in-house. You have to have students and medical students and laboratory students dealing with that stress in real life situation, as the good doctor knows. I mean, you just cannot, you cannot simulate that. You can do everything you possibly can to stress people out and put them in those situations, but it's not life and death. It's not quite the same.
Right.
So you're right. I mean, that training, especially in clinical programs, but even in things like, you think about maybe areas of other healthcare areas like physical therapy and speech pathology. I mean, you've got to get your hands on people and patients, or it's just not the same.
Yeah. Right. All over, airplane pilots, medical field. We're going to have sports. I mean, if you're not doing it, if you're not physically out there playing the game, simulating just doesn't count, unless of course you're playing esports, in which case it's okay.
Hard to teach somebody how to swim without getting in the water, isn't it?
True.
Right,
exactly.
Right,
yes.
Right.
So I'm being told we need to wrap it up. So final thoughts, Lomas?
Yeah, final thoughts. Am I still plugged in? I'm sorry. Am I still here? Okay.
You're still there.
I'm
Sorry.
still there.
We talk too much.
I know my dog is in here, but no, that just final thoughts, I'm just hoping that, I know
like Dr. A said, you know, half of the people not taking this serious. And it's just sad when you see the number of people, like we said, that are dying from this. And, you know, the sad part is it's a number. They're a number. They're part of that 3,000. Right. You know, it's not a name, which I think would be more effective. And I know it's HIPAA laws and all kind of things like that. But I think if it was a name up there instead of just a number, I think it would strike people a little bit more. And I think they would take it a little bit more serious. So, you know, I'm just hoping that people do that.
Yep.
Yeah. Doc R, any final thoughts on this?
You know, just kind of piggytailing on that a little bit. I mean, I've been telling friends and family and others that if you really pay attention, especially in the last month, that circle of who you know that's been affected by this disease is tightening. Really tight. I've actually had students tell me that they've lost their grandparent, you know, or they've got their children homesick, and so, you know, I feel that. I think, you know, that's speaking to Lomas's point, that people need to kind of pay attention and understand that we are still in the middle of a full-fledged, unchecked pandemic where the virus is rapidly spreading through the community. And I feel like the country's kind of relaxed a little bit and got a little comfortable with whatever, eating out, you know, walking and doing things with more people and doing things. So maybe just kind of, you know, for your audience and others to kind of remind themselves and to remind their friends and family that, you know, to hang tight and to try to double down on some of their efforts to be careful over the holidays, be ready for that vaccine, educate yourself. If you're not sure, talk to someone, talk to Dr. Durbin, you know, talk to a physician,
absolutely.
Talk to an expert, do your own education. It's probably some of the safest data we've seen. There's always a little bit of adverse effect issues, but that's with anything. And to really get behind public health and let's get this thing done in the coming months so that we can stop these daily counts. It's just terrifying to watch that daily.
You're right.
It's horrifying. It's horrifying. Yeah, it's as Doc R says, hang tight. I think, you know, we're seeing some light at the end of the tunnel. We're seeing vaccines come online. I think we're going to see more come online January, February, March. And I think, you know, it'll be interesting. I think, you know, baseball season may be delayed, but I think we're going to have a more normal baseball season than we had last year, and hopefully a more normal life starting June, July of this year. I hope. But we've also got to get people to take the vaccine.
Right.
So that's the other issue.
One other quick question. So even if you get the vaccine, you still, right, you have to mask up, right? That doesn't, even if you get it, you still must mask up, still do all the precautions that you were doing right before you got the vaccine, right?
At least for the coming months. Yeah.
Yep. And that's to help.
Good point.
That's to help prevent you from spreading it to somebody else. Likely once you have the vaccine, you may not get sick, but you can still get infected and spread the virus without getting sick. And we know that from all of the asymptomatic people who have been spreading virus.
Right.
You know.
Good point.
Great.
Wow.
Yeah.
Okay, so thank you so much, Doc A, Doc R.
You're so awesome.
You guys, I learn so much every time I do this.
So awesome. I'm telling you.
Yeah, I want to have you on every week. So
we need to take this national.
I hope the next time we're on, we're all drinking champagne because we're going to be seeing it. We've turned the corner.
Yes. Well, let's hope so. But to everybody who's listening, please stay safe. Keep up the good work with staying home. Celebrate Christmas another month. Celebrate, you don't have to get together because it's this particular day. I hate to say that, and everybody will, but stay safe, stay healthy, stay alive.
Yes.
This is not a political thing.
That's
right. Stay alive.
That's right. That's right.
Okay. Thank you.
Thanks,
everyone.
Always a pleasure.
Absolutely.
Yeah. Take care now.
Okay. And check us out on Facebook and sportslaw.com.
Yep.